What if one day your doctor tells you you have prostate cancer? Most men immediately think, get it out of me. But here's the dangerous part. The treatment you choose may affect your daily life, your bladder control, your sexual function, and your overall quality of life for decades. Let me show you how doctors actually choose the right treatment. In the previous video, we talked about the side effects of treatment, erectile dysfunction, and urinary leakage. Now we need to talk about something just as important, how doctors actually decide on treatment that is best for you. When most men hear the words prostate cancer, the instinct is immediate. You want to get it out, you want to get rid of it to save your life. That reaction is very human, but modern medical principles actually emphasize one thing. In most cases, you do not need to rush the decision. Most prostate cancers grow slowly, so the decision you make today may influence your quality of life in the next 20 years. Doctors classify prostate cancers into 3 risk groups: low risk, intermediate risk, and high risk prostate cancer. We determine this risk using your PSA level, the results of the biopsy, including a Gleason score, and the results of your MRI. And naturally, most men think about this question this way: how do we remove it as fast as possible? But the real question is how aggressive this cancer is, how dangerous it is to you, and how to treat it with the least minimal side effects. Before we go further, I want to thank the community. Hundreds of men are sharing their stories and helping shaping the stories of other men for the better. This openness matters, and I'm deeply grateful this message is resonating. So how do we decide on treatment? The principle is to match the aggressiveness of tumor with the aggressiveness of treatment. Overtreating a slow-growing, non-aggressive tumor may cause unnecessary side effects. Undertreating an aggressive tumor may put your life at risk. In many cancer centers, these decisions are made by multidisciplinary teams where several experts sit in one room and discuss your case, and this is later presented to you, and you have a say what you want with your tumor done. Each treatment have different pattern of side effects. Active surveillance usually preserves the quality of life the best at the beginning because the treatment itself is delayed. Surgery tends to cause more immediate side effects that are related to the surgical procedure itself and the damage. Radiation, which is basically a strong beam of X-ray concentrated on your prostate, usually avoids surgery, but the side effects appear gradually over time. And when radiation is combined with hormonal therapy, which it often is, that can add systemic side effects from lowering your testosterone, like hot flashes, fatigue, or lower libido. None of these treatments are without cost. They simply involve different types of trade-offs. Now let's talk about the active surveillance and watchful waiting. This first option surprises many men. So this is suppressing your instinct to treat right away to get it out. Because for men with low-risk prostate cancer, guidelines recommend using active surveillance as a primary option. And this does not mean we are ignoring the cancer. It means we are monitoring it very carefully. It includes regular PSA checks, regular biopsies, and periodic MRI scans. If the cancer is showing signs of becoming more aggressive on these examinations, we may then shift the strategy towards active treatment. Large clinical studies actually show that men carefully selected for active surveillance have excellent long-term survival outcomes. This means delaying the treatment for some men for years, and some may never need treatment for all of the life. But the hardest part of this strategy is psychological. Learning to live with cancer inside me that can damage me one day is not easy. There's also another observational strategy called watchful waiting. This is typically reserved for older men or those with significant health issues. In this situation, the goal is not cure. We actually monitor the symptoms, and if they appear from cancer, we treat those symptoms to make the quality of life better. The second major option is surgery called radical prostatectomy. This operation removes the entire prostate gland and tissue surrounding it. Today, the most commonly performed surgery and how it should be performed is a robotic surgery. One advantage of the surgery that cancer is physically removed from the body. The entire prostate can then be examined under the microscope. We call it histological examination. That gives us information about how aggressive the tumor is, and it also gives us the Gleason score. For many men in intermediate and high-risk groups, the radical prostatectomy, the surgical treatment, is a way to go. However, surgery also carries risks. As we discussed in the previous video, it can affect your erectile function and also cause urinary leakage. But modern nerve-sparing techniques aim to preserve these delicate structures, those little nerves that are responsible for the function, and our goal is improve the quality of life in every man that goes for the surgery. Also, recovery requires time and dedicated rehabilitation. For many patients, the decision between surgery and radiation comes down to the fact which treatment approach and which side effect profiles they feel most comfortable managing. The third major pillar of treatment is radiation therapy. Radiation can be delivered in two main ways. External beam radiation directs high energy X-rays from outside of your body to the prostate. And then there's brachytherapy that includes placing little sources of radiation inside your prostate. Modern radiation techniques are highly precise and can achieve the cancer control rates comparable to the surgery. One advantage is that it avoids surgery, there is no hospitalization time, there is no recovery. However, radiation also have its own side effects profile. Some men experience urinary or bowel irritation weeks or months or years after radiotherapy, but erectile dysfunction can gradually appear over time and usually gets worse. For men with intermediate and high-risk prostate cancer, radiation therapy also involves treatment with hormonal treatment, which we called androgen deprivation therapy, basically meaning we are depleting you of your testosterone, because testosterone for prostate cancer is like the fuel for the fire. This helps radiation work more effectively, but it can cause temporary side effects like hot flashes, fatigue, lower libido, or gaining weight. Now, let me ask you something. If you were diagnosed with prostate cancer today, what type of treatments would you worry most about? Surgery, radiation, or you want to get it out and you would be worried about active surveillance? Tell me in the comments. I read every one, and I know that navigating these options can feel overwhelming. If you are still early in the process, you are testing for your PSA, or you are deciding on a biopsy, I created a free printable checklist for you to download and bring to your urologist to ask questions. And if you're trying to understand PSA levels and biopsy decisions in a more organized way, I created this optional paid PSA guide. It's 14 pages you can print out and take to your doctor. All the information in the guide are free in my videos. The guide just organizes it. You can download both the free checklist and the PSA guide down in the links below. Choosing between surgery and radiation and active surveillance may be one of the hardest decisions a man has to take during his lifetime. Two men with the same diagnosis choosing different treatment strategies may both be right. There is no universal best treatment. Best treatment is the one that controls your cancer, maintains your quality of life, and fits your life expectancy. So please take your time, gather your information, get a second opinion if needed, and only then act and decide what treatment is best for you. If this breakdown helped you clarify your option, please consider subscribing. Your support also helps to spread the information to the newly diagnosed men who may be terrified right now. And if you feel like it, please share your experience in comments below. This can also help to build our community. Stay strong, stay informed, and I'll see you in the next one.